And we're back.
Yep, and we are just getting our third conversation for this morning started. And as we said before the break, we are talking all about a mental health forum which is being hosted by the Ministry of Rural Transformation. And joining us via Zoom to tell us all about this, we have Anne-Marie Thompson, who is the Labour Commissioner. Good morning.
Hi, how are you? Good morning.
Doing well, and thank you for coming in and sharing all about this. This is such a great initiative. Can you talk a little bit about how the idea for having a forum like this came about?
Well, thanks. And of course, we can't take all the credit. I have to thank our partners like PAHO, the Mental Health Association, our trade union colleagues, the Chamber, and other organizations that joined with us. Well, we know that mental health is an important aspect of health. If you're going to have good health, it means that you should have good mental health. And with COVID, we know that has brought on some stresses. When the Labor Department goes out into the field, we do so with the aim to protect labor. And we're expanding that to mean another aim to protect the mental health. And that is how it came about. We thought, how can we assist our workers, especially our public officers, those workers also on the front line? How can we help them? We hear of their stresses, we hear of their anxieties. So we reached out to our partners and we decided to have a mental health forum under the theme, let's talk mental health, let's protect mental health.
Yeah. Now this is, I was telling you jokingly during the break, we all need this. It has been a part of a underlying conversation that we're talking about our mental health and COVID-19, but we don't talk about it in the workplace and we don't acknowledge that it's taking place. You said you
Yes.
Go ahead.
Yes, I think it's a best kept secret,
Yeah.
and we want to thank the media and our partners for bringing it into the mainstream, because every 4 persons that gather, one of us is experiencing mental health issues or will experience mental health issues in our lifetimes. So it's very prevalent. It's just that, as we all know, there's a certain stigma that is attached. Nobody talks about, I am bipolar, I am schizophrenic, I have an eating disorder, I have a mental disorder, but we're saying, let's talk, let's do something about it because we can overcome.
Yeah. You spoke of the specific public officers who will benefit from today's forum, and it will be online, so people can be able to access it for free, right?
Oh, definitely. When we began the discussions, we thought of having an in-person conference, but with COVID and being responsible and wanting to do the right thing, we moved it online. So it's open to the entire public. And I must give a special invitation to our parents and grandparents who are out there. We know that mental health cuts across all ages, including our children. Yeah. So today we have a representative from the Ministry of Education, a counselor, Ms. Young, who will be speaking about mental health as to how it affects our children.
And actually, that was going to be my next question, and we're actually displaying the graphic right now, showing some of the participants in some. So what sort of material is going to be covered during the forum? We just touched a little bit, so. What more can we expect?
Well, it's going to be very interactive. It won't be a lecture. It's going to be interactive, and we have a good lineup of speakers. For instance, we have to look at the clinical aspects of mental health illnesses. What are the illnesses? How do we identify them? So we will have a doctor who is a psychiatrist, Dr. Martinez. She is assigned to Belize Medical Associates. We will have counselors. One of them is Amy Jex. She will speak about conflict resolution. We will have our own participants from the public service. We will be speaking about the employee assistance program that we give to public officers who are experiencing personal, family, or work issues. And of course, we will have a testimonial, because you see, mental health, it's really not a death sentence. Mental health illnesses can be treated, they can be reversed. So we want persons to know that, we have the resources, and if you access them, there will be some normalcy. So we will have a testimonial. And of course, we will also, the law cuts across every facet of our life. So we will have Chief Magistrate Sharon Fraser. We will have one of our partners from St. John's Credit Union. Financial management is key. A representative from the Social Security Board. So it's going to be dynamic, it's going to be interactive, and there is something in it for everyone. So even if you're not suffering from a mental health illness, you may know someone, and having the information is key so that we can protect the mental health of all our families and loved ones.
Nice. Now, looking at the partnerships that you have there, my question has to be, do you imagine moving beyond just having the conversation about mental health in this type of forum? Because one of the things, for example, maybe getting the Social Security Board on board, talking about things like sick days that do include when you're in a mental health crisis. This has been a challenge, I know, for people who do have mental health illness, to be able to feel comfortable to say, I'm having a depressive episode, or I'm struggling with my bipolar disease. So how do you move beyond just saying it exists amongst us, people are mentally unwell at times, to also ensuring that they're protected within our labor laws?
Well, you're correct, because when we treat with mental health, and remember, I am no expert, but
Yeah.
with it, we have to take a three-pronged approach.
Yeah.
So the first thing we agree on is raising an awareness. So today we are starting the first of a series of conversations. It won't end today. We will continue. So let's raise it. The other aspect is to prevent mental illness, and we can do so in our daily lives through different means. Something as simple as taking up a hobby, or doing exercise, or speaking. Yeah, so whatever we can do to prevent is very important.
Yeah.
And the other aspect is advocacy. So today we will be inviting trade unions, workers, employers. Let's look at how we can address mental health issues in the workplace.
Yeah.
For instance, are there policies? Can we put policies in place?
Yeah.
So that's the conversation we're going to have. If someone is continuously absent, instead of taking a disciplinary action, can we resort to putting in an intervention that may relate to mental health, to address and to help that person? So that's the approach we want to do. And beyond that, no doubt we have to reach out to our medical facilities to provide quality mental health services. And one may ask, what is quality mental health services? Obviously, it starts with protecting the rights of those who access the services. Not because I'm schizophrenic, not because I am bipolar, I should be treated in a particular way.
Yeah.
I have labor rights, I have human rights. So it starts with providing quality service, respecting the rights of those who need it. In addition, making sure that service is equitable, efficient, effective, and timely.
The public service ministry also has, is it through public service or human development that they have the support services built in for public officers? Does that include mental health?
Well, it definitely does, because it has the Employee Assistance Program,
Yeah.
EAP. And many or I should say, other organizations have that program for their employees. This, in principle, is a confidential program, free of cost, where through the public service, or if it's individual companies through the HR departments, employees can confidentially go to someone and say, listen, can you help me with my personal problems, marital problems, problems at home, problems at the workplace, and they would more times than not offer counseling, refer that person to have counseling services. And so we are saying, if you have EAP, employment assistance programs, or continue, why not promote it so that persons can get assistance?
Mm.
And is there any? Well, I suppose this forum is targeted to be sort of general or covering mental health in a general way. Is there any sort of or is there any particular target or aim at the end of it, that you hope to achieve by the end of the forum?
Okay, well, as I said earlier, the theme is let's talk mental health. Let's protect mental health. So if the conversations continue, that in itself is a good thing because we need to speak about it. And let's protect mental health. Today we have our partners. We have representatives from the Mental Health Association. Many persons don't know about that organization. So I'm hoping that, we will be free to contact our colleagues there if there are issues. Please contact the Mental Health Association. They can provide assistance. We also have the Ministry of Human Development. That ministry can be contacted for assistance. We have the National Drug Abuse Control Council. So today we will also be highlighting those agencies and those resources where we can contact for help because we don't want anyone to suffer in silence. We want to help persons. Mental health is not a death sentence. There is no stigma to it. We could just turn to the right persons, the right organizations, access the resources to help us.
All right. So who can join in today?
Oh, the entire world. We are online. So please, we start at 9 o'clock and we end after 3.
Okay.
There will be different activities. We will have activities, we will have music. We have Jackie Castillo, please join in. And we have the different presenters, as I say, from the Social Security Board, the Chamber, the Public Service Union, St. John's Credit Union. So we have the Ministry of Education. We have a variety of speakers giving different perspectives. So there is something in it for everyone. We want our country to have, our citizens to have the best mental health. And we are very delighted to be able to work with our partners. Thanks to everyone to make it possible. We know that Mental Health Day is October 10th. Yeah. So we're actually early. So this, I think, is a good start. Please join us, everyone, for 5 minutes, 10 minutes, half an hour, or for the entire program. There is something in it for you, your families, and your community.
That's right. Thank you so much. We appreciate it. And Mental Health Day is in October, but the World Day for Suicide Prevention is in September. And we know that very often we do have cases of suicide in this country. And if we take care of our mental health, we can prevent some of these deaths. So great initiative. We hope that you are flooded with participants. But more importantly, I hope that it gets the conversation going in the wider community.
Thank you. We hope so. So let's talk mental health. Let's protect mental health. And please join us today and do all we can. Thank you very much.
All right. And with that, we are going to go ahead and take our final break. And when we come back, we'll have our wrap up. So stay tuned.